This is Dr. Karthik. So today in this video, I'm going to explain how the antimalarial drugs, that is hydroxychloroquine and the chloroquine, are helpful in treatment of the coronavirus infection. So now let's come into the mechanism of the action of the hydroxychloroquine and the chloroquine, and how this hydroxychloroquine and the chloroquine helps in the stopping the replication of the virus inside the cell of the human body. So now consider this as a human cell and consider this as the coronavirus. So coronavirus has some spike proteins on the top of the coronavirus body, and the human cells has AE2 receptors. So these AE2 receptors helps in binding with the spike proteins of the coronavirus body, and then they both get merged with the process called glycosylation. Because of this glycosylation, the virus gets replicated inside the host cells, and the virus replications, as the virus replicates, the infection becomes severe. So now how the hydroxychloroquine and the chloroquine helps in the reduction of the infections. So now I will tell you. So how it is. See, this hydroxychloroquine and the chloroquine interferes with the process of the glycosylation. By this glycosylation process, these two binding process happens. So as this glycosylation is interrupted with the help of the hydroxychloroquine and the chloroquine, the virus replication will be prevented inside the host cells. So by this we can be able to prevent the virus replication inside the body. So now, what are the common side effects of this anti-malarial drugs, that is the hydroxychloroquine and the chloroquine? Hydroxychloroquine does not produce much side effects as compared to the chloroquine. So the preferable choice of the drug is hydroxychloroquine. And hydroxychloroquine and the chloroquine both act as immunomodulator, and that will activate the T cells, and T cells is a part of the immune responses of our body. So this T cells activation will automatically help in the immunomodulation process. So now common side effects of the hydroxychloroquine as well as the chloroquine, that is headache, dizziness, gastrointestinal upset, and the rashes. And the retinopathy is the most common side effect, as well as the most severe effect is the variation in the ECG reports, that is the ventricular arrhythmias usually will be faced by the patients when the proper dosages or the overdosages happens. So currently, as far as the research process, we are using hydroxychloroquine of a 400 mg, and we are combining another antibacterial drug that is called azithromycin. Azithromycin dosage which is used is 500 mg. So now currently for the COVID-19 patients, we are using this hydroxychloroquine, as well as the doctors who are treating directly the COVID-19 patients are also more prone to the infection or more susceptible to the infection. So these drugs are also used by them. And for the asymptomatic patients also, we are up to the level we are using, whoever indirectly or directly under control. So as a public, what we should do is unnecessarily we should not go into the pharmacies, as we know this, that the hydroxychloroquine is the drug which is helping in the COVID-19. Some people will immediately think that, oh my god, I am having a sore throat, I am having a congestion nose, and I am having some severe respiratory tract infections, like that I am having difficulty, and most people get panic, and unnecessarily they are going to the pharmacies and demanding for the hydroxychloroquine for the personal use. See, these all drugs should be used only with the help of the only with the help of the physician's prescription is very mandatory for that. And if you are getting any symptoms of any respiratory tract infections or anything like cough, cold or sore throat, immediately you should report to the nearby health center and get yourself checked for the coronavirus symptom. And then if it is required, these drugs are required for you for the treatment, then definitely this will be prescribed by your doctor and you will be under the health care for that. So unnecessarily the misuse of the drug should not be happening. This is what the kind request I am giving for the whole public, because these drugs should not be misused. This drug definitely should not be misused. And as well as these drugs are definitely required worldwide also right now. And as you all very well know, our country, India, is right now exporting these drugs to the severely affected countries like US, Italy, all that. And also many countries are dependent upon us also for this. So unnecessarily the misuse of this drug should not definitely happen. So kindly understand the scenario, stay healthy, be healthy, think positive, do good for all, serve our nation. Jai Hind.